Hi, I'm Marlyce Surgis, and I'm completing my head-to-toe assessment video for Maryville University. This is my patient A. Before this video, we took a complete set of vital signs, took her height and weight, and we also had her empty her bladder. We also checked her vision using the Snellen chart. Alright, so first I'm going to inspect her head and face. I'm looking for the skin integrity, skin texture, and symmetry of her eyes and ears, and looking at her skull, looking for any obvious malformations or masses. Next, I'm going to palpate her scalp and hair. We want to make sure the hair is evenly distributed and does not come out easily when touched. Going to feel the facial bones. And we're going to feel the sinuses, palpate the sinuses. Alright, next I'm going to have you open and close your mouth. I'm checking for any popping or cracking. Do you have any pain when you're doing that?
No.
That's to check the temporomandibular joint. Alright, next I'm going to use these to test your sensation. So I'm going to have you close your eyes and tell me if you feel these equally.
Yes. Yes. Yes.
Alright. Next, we are going to check your cranial nerve function. So I'm going to have you clench your teeth, smile at me real big, stick your tongue out at me. Good. I'm going to have you close your eyes, clench them shut, wrinkle your forehead, stick your tongue out at me, and puff out your cheeks. Good. Alright. Next, we are going to check her eyes. We're going to check her eyelashes and her eyelids for the hair distribution. Make sure her eyelashes are coming out. We also want to check and make sure that her sclera are nice and clear and that her conjunctiva are nice and pink. Going to palpate for the lacrimal apparatus. Next, I'm going to check her pupillary response. I'm going to have you look straight ahead. I'm going to check her pupil for constriction while checking her other eye also for accommodation. Alright, next I'm going to have you uncover your eye with your right hand and look straight forward. And then I'm going to have you do the opposite hand, the opposite eye. Do you have any vision changes between there?
No.
Alright, now I'm going to check the 6 cardinal gazes on each side. So we're going to go this way. Follow the pen light. Alright, next we are going to check her ears for alignment and placement. Palpate the auricle. I'm going to do the whisper test. I'm going to whisper a word to you. I'm going to have you repeat it to me.
Banana.
Pineapple.
Pineapple.
Alright, we are going to use a tuning fork, the Weber test. I'm going to strike this and I'm going to have you tell me when you, if you hear it on one side or both sides equally.
Both sides.
Alright, next we will perform the Rhine test, and I'm going to strike the fork and place it behind your ear. Tell me when you don't hear it, and then I'm going to move it outward and then tell me when you don't hear it.
No. No.
And we'll do that on the other side.
No. No.
Alright, next we will check her ear canal using the otoscope. Her tympanic membranes are pearly gray and intact with no cerumen impaction. Okay. Next, we are going to check her nose. Going to make sure the structure is symmetrical, and then we're going to inspect her nasal mucosa, hair distribution, septum and turbinates. You look up. Now I'm going to have you cover one nostril and inhale, and then now do the same. Did you have any changes between the nostrils?
No.
Okay. Nice and patent. Next, we're going to inspect her mouth. So I'm going to check her lips and make sure see if there's any cracked edges. Gonna check her gums. They should be nice and pink and intact. Check her teeth for color. Check her breath for any odor or malodorous sensations, and then we'll also check her hard and soft palates, the floor of her mouth, the anteroposterior palate pillars, the uvula, and her tonsils. So I'm going to have you open up, say ah. Also checking her teeth. There's no cracked teeth or obvious cavities. Move your tongue to the side. Move your tongue to the other side. Good. Now I'm going to check your gag reflex. All right, good. All right. Next we're going to check the reflexes. So first we'll check the brachial. Make sure you're nice and relaxed. And the radial on both sides. And now we'll check your knee and the Achilles. Next, we are going to check your muscle strength. So I'm going to have you push out against me. Good. Now I'm going to check your range of motion here. So I'm going to have you put your head forward and back and then to each side. And shrug your shoulders. And now resist me. Good. Alright, good. Next we are going to inspect her neck. We want to look for any obvious masses. Check it for symmetry and smoothness. We want it to be nice and supple. So there's no obvious bulges here. We're going to palpate carotids. Make sure her trachea is nice and midline. And then check her thyroid. Next, we're going to auscultate her carotids and thyroid with Bell. Now we're going to check her lymph nodes. So we're going to feel the pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, the superficial cervical chain, the posterior cervical, the deep cervicals, the supraclaviculars, and I'm going to have you lift and check axillary. Good. Next we're going to look at her upper extremities. So we want to inspect and palpate her hands, arms, and shoulders for skin integrity, even tone and temperature. I'm going to check her fingers for any signs of clubbing. Check her capillary refill, and that's nice and rapid in less than 3 seconds. I'm going to check your brachial pulses and your radial pulses. Okay, now I'm going to assess your back. So I'm going to have you stand up. So we want to feel her cervical spine and make sure her spinal canal is nice and straight. So her cervical, thoracic, and lumbar spine. You want to feel it for any masses, bumps. Everything is nice and midline. We would also inspect her skin and the thoracic configuration. So I'm going to have you take a seat and put your legs that way. While I check her back, I'm going to be inspecting her respirations, making sure they're unlabored, nice and equal. I'm going to palpate and percuss the costal vertebral angle. Do you have any tenderness here?
No.
I'm going to have her take a deep breath and feel the expansion here, and everything is equal. Next, I'm going to, when you feel my hand, I'm going to have you say 99.
99, 99, 99, 99.
And I'll have you lift and do the same for the sides.
99, 99, 99.
And now again.
99, 99, 99, 99, 99, 99.
All right, now I'm going to have you take a deep breath and hold it. And I am going to percuss here for the diaphragmatic excursion. All right, you can take a couple breaths. All right, now take a deep breath and exhale. And I would want to find an area of about 3 to 5 centimeters for the diaphragmatic excursion. Next, I am going to auscultate her lung fields bilaterally and laterally. Take a breath each time you feel the stethoscope. Now I'm going to listen on the sides. Okay, now I'm going to have you turn around, face me. So for her skin in the front, we would want to also check for skin integrity, temperature, and symmetry. Checking her respirations are symmetrical and unlabored. We also want to look for any pulsations or heaving, so there's nothing evident with inspection. We want to palpate her chest wall here, the precordium for thrills, heaves, or any pulsations. And we'll feel her left chest for the apical impulse. I'm going to have you take a deep breath and make sure it's nice and even. So next we are going to auscultate the heart sounds. Alright, first we will listen for the aortic, and pulmonic, Herbst point, tricuspid, and mitral valve. And then we will also listen for her lung sounds anteriorly. So take a deep breath for me. All right, next we will check your abdomen. You want to lay down for me? So before we would touch her abdomen at all, we would inspect it. We want to look for contour and pulsations and any obvious movement. Next we would auscultate. We'll auscultate each quadrant, and we would listen for up to 5 minutes to hear bowel sounds. And then we will also auscultate the aorta, the renal arteries on both sides, the iliac arteries, and the femoral arteries. Next, we want to percuss for tone and liver border. Actually, before I do that, I'm going to have you sit up a little bit. I'm going to check her abdominal muscles. So I'm percussing till I find the dullness from this end, and then I'm going to do the same. And I would want to find about 6 to 12 centimeters, and those would be the liver borders. And then I'm going to do the same on the right side to feel for the spleen. make sure that's nice and dull. Going to use light palpation on the right side. Should not be able to feel the liver in a healthy adult, so we would go light and then deep palpation. And then the left costal margin for the spleen, again, should not be able to feel that in a healthy adult. Next, we want to feel for the right kidney. Should be able to feel the right kidney. And you want to palpate for the left kidney. And feel for any pulsations, and aortic pulsations. All right. Next, we are going to check her feet and legs. So I'm going to check her skin and hair distribution and muscle mass. And I'm also going to check her temperature. Going to check her for any edema. Also going to feel her pulses, the popliteal, posterior tibial, and dorsalis pedis. Going to check her toes here for capillary refill, and it is rapid. And that will conclude my assessment. Thank you for watching.